Are you a caregiver or someone who is helping another person brush and floss their teeth? I'm Whitney, a registered dental hygienist, here to give you tips on how to make it easier. Brushing someone else's teeth can seem difficult, but with the right tools and the right technique, it is possible for it to go smoothly. Starting with a 3-sided toothbrush. I prefer the electric ones, but if the person you're caring for doesn't respond well to the vibrations or to the noise, then you can use a regular 3-sided toothbrush, but I would definitely try the electric first if possible. Also, you don't have to necessarily be in the bathroom. You can brush wherever you and the person you're caring for will be comfortable. If it's on the couch, laying in bed, wherever is best for both of you. Just make sure to bring a bowl or a cup for them to spit into. Now, the best advice I can give you is telling them to not open too wide. Open just a little. This way, the toothbrush can better fit inside their cheeks, especially for the upper teeth in the back, the top molars. Those are always a difficult spot to reach. So by having them open ever so slightly, now their cheek is more flexible and you can easily pull it away. Whereas when they open too wide, then the cheek is too tight and you can't get back there. The jaw gets in the way. So have them open just a little, and I like to start in the upper right corner for about 30 seconds or as long as you can. You should clean each quadrant. There's 4: upper right, upper left, lower right, lower left. You should clean each for 30 seconds, totaling a 2-minute brushing session. However, I know with some special needs populations, you might need to do 15 seconds in each quadrant to start, or maybe depending on the day, some days you can get through the full 30 seconds better than others. Just don't get discouraged. You will make your way up to the full 2-minute point soon enough, especially since it's important to brush all of the teeth twice each day. So if you're having trouble in the morning, maybe just focus on the top teeth, getting the full 30 seconds in each quadrant on the tops, and then quickly brushing the lowers. And then at night, maybe then you can focus and make sure you get the full 30 seconds in both quadrants on the lowers. Sometimes you just need to get creative on how you time it all out. Regardless, if you're using the 3-sided electric toothbrush, just let it do the work for you. Guide it along from tooth to tooth slowly, and make sure you don't skip any teeth. If it's a regular 3-sided toothbrush, you just gently vibrate it back and forth, like I'm showing you here. Again, this would be with a regular 3-sided toothbrush, not the electric. Always let the electric ones do the work for you. I will link 3-sided toothbrush product recommendations in the description box, but until then, if you're using a regular toothbrush, again, do the best you can, cleaning all the tops and bottoms and fronts and backs of every tooth. Gentle circular motions are what I like to use, and if you do have a regular electric toothbrush that isn't 3-sided, same thing. Guide it along from tooth to tooth, letting it do the work for you. Brushing all the tops, bottoms, fronts, and backs of each tooth. 30 seconds in each quadrant for all toothbrushes, total to a 2-minute brushing session twice each day. Now onto flossing. Floss picks are the best when you're flossing someone else's teeth. It makes it so much easier since it gives you a handle to hold versus putting your fingers all up in their mouth. Depending on the situation, of course, maybe you're wearing gloves if you're caring for someone who isn't related to you, but if it's your own child or something like that, just always make sure you wash your hands beforehand. When you're using the floss pick, try your best to not just pop it in and out. You really want the floss to hug the tooth best it can. So sometimes if you can bend the floss pick, that's helpful. If it isn't bendable, again, just focus on cleaning the left side up and down and then the right side up and down. The sawing motion, the seesaw motion is not doing anything. Don't use the sawing motion except for inserting it into where it needs to go. Once the floss is between the teeth, you want to use the cleaning motion, which is up and down, cleaning the sides of each tooth. If the person you're caring for can swish and spit, it's always a good idea to use a fluoride mouthwash after brushing and flossing. Fluoride anti-cavity mouthwash will help strengthen the enamel and protect against tooth decay. But if they cannot spit properly, then just make sure you're at least using a fluoride toothpaste. A grain of rice-sized smear for those who can't spit very well, and a pea-sized amount for those who can spit enough. It doesn't have to be perfect spitting. It's usually recommended that ages 3 and up use a pea-sized amount, and ages 3 and under, including infants, can have a grain of rice-sized smear put on their toothbrush. Depending on who you're caring for, you or their physician should be able to give you a recommendation on their spitting capabilities. Some dentists will prescribe a prescription strength toothpaste for those who need extra help at home. So always ask your dentist if this is something that would benefit them or not. It just depends on the health of their teeth. And of course, always be sure to take the person you're caring for, take them to the dentist at least every 6 months. months. Depending on the status of their gum health, your dentist and dental hygienist may suggest every 3 months or every 4 months, but at minimum, every 6 months is recommended. If they recommend fluoride treatments in office, definitely consider getting those. Although sometimes fluoride is not covered by insurance for adults, it's usually pretty inexpensive, averaging around $35 for a fluoride treatment, give or take. But really, that $35 can save you hundreds, even thousands of dollars in dental work, so it's definitely worth considering. Even if it's not covered, it's a fantastic tool at helping prevent against tooth decay. Anything to avoid needing dental procedures, right? Such as fillings, crowns, root canals, anything that can lower the chance of needing more dental work is always worth it for the patient's comfort and overall health. In all, just remember, all we can do is the best we can. Don't get discouraged if it's difficult at first caring for someone else's teeth, because I know how difficult it can be to care for our own teeth, right? So I will link bettermouth.com. It's a great program that helps make dental care feel less like a chore and more like an act of self-care. If you want that extra motivation, then I highly recommend it. It can really help build your confidence and help you form dental health habits for those who aren't independent enough to do oral care themselves. And I hope this video helped you. Please share it if you think it would help someone, and also press like, subscribe, and turn on your notifications if you want even more dental health tips. As well as my website, teethtalkgirl.com. If you're looking for a specific dental topic, I have a search bar where you can easily find what you're looking for. And thank you again for watching. Until next time, I'll see you on Instagram at teethtalkgirl. Peace, love, and teeth.